Hello, everybody, and welcome to this afternoon session on Interburns going live for the Wales for Africa Health Links conference today. The conference is called Health for All 2020, and I'm your host, Hannah Shepherd from Hub Cymru Africa. This event's going to be in a webinar format, so I am just going to share with you some housekeeping. So we're in a webinar format, so only our panelists can share their microphones and video, and therefore everybody else who's joining us today is going to be muted. But we've got the chat box to the right of your screens where you can say something nice, and I'd invite you to, it's wonderful to know who we're talking and who's joined us today. So please do take a moment and introduce yourself, because it really helps us to know who we're talking to. You can also ask questions, which is using the Q&A box, which you can access by pressing the Ask a Question button, which is at the bottom of your screen. So we're going to come to questions. We're going to allow time for all questions at the end of the presentation. So we're looking forward to asking those to you. We really also value your feedback, so I'm going to ask you all to complete the feedback survey, which I'm going to post in the chat box at the end of the session. And, this is a safe space for everybody, and so therefore I'm making sure that any form of abusive or offensive language or behaviour in the chat box is not going to be tolerated. And I'm going to ask you to please listen with respect and be mindful of the experiences of others. So I am now going to hand over to our chair for today, Dr. Catherine Thomas, who is chair of the Wales for Africa Health Links Network. There we go. Can everybody? Yeah. Thank you, Catherine.
Hello, everybody, and you're very welcome to this session, which I'm very pleased. I went stalking Lucy to come and do this session. I've been watching the organisation Interburns from afar for some time, and I think you are amazing, that you're a truly global organisation, and we're delighted that you're based in Wales. And particularly impressed by the fact that many of the health partnerships that are clinically focused are focused very much on healthcare services and treatment, whereas Interburns have taken a strong kind of prevention and public health approach to everything. So you go right across an approach to burns, from prevention to treatment to rehab and so on. I'm really interested in the kind of breadth of what you do in Interburns. I'm delighted that Lucy King, who's program manager at Interburns, is able to share experiences with us, in particular in the situation we're in at the moment with COVID-19, and we're all having to deal with the fact that we're doing partnership working without being able to do international travel. So we're all thinking of ways that we can do this in a different way. We've been doing it for some time anyway because of climate change and our carbon footprint, and trying to find ways of using digital technology. But I was particularly interested in that you developed an Essential Burns course, which is online learning, which is kind of the kind of thing that we're all looking at doing. So whether some of the way that you're working is generalizable to all health partnerships would be of real interest to us. So Lucy, I'm really delighted that you're able to be with us this afternoon, and fire away.
Thank you. Well, thank you very much, Catherine, and thank you, Hannah, as well. And thank you for that great introduction. I didn't know I was being stalked, or I would have been more wary of where I was walking. But I just want to say thank you very much to Wales for Africa, not only for organising, inviting and hosting this event, but also for the support that Wales for Africa has given Interburns over the years. So Interburns has been based in Swansea, set up by Professor Tom Pottekar, who's based in Swansea. And I'm actually sitting in Oxford now, but we regularly visit Swansea, which is great. But Wales for Africa have very much supported us from very small beginnings and into a place where we are actually having a lot of impact as Catherine said, globally. So thank you very much for that. And thank you all for joining this session. I hope you'll find it interesting. I plan to talk for about 20 or 25 minutes, which is probably enough for you listening to my voice. But then it would be really nice to have any questions or anything you'd like to say after that. So just a few words about me. I don't have a medical background, but I've worked in international development and lived and worked in Asia for 20 years. I sometimes think it helps not to be a clinician, as I'm allowed to ask all the most simple questions and to not know anything, which I think for online learning is really quite important, because we have to remember to be very clear and explain things to an audience that's very far away, living in very different conditions. And we have to keep the message very, very clear. So we try and convey the message as clearly as possible. Since I came back to the UK in 2008, I've been involved in online training for healthcare workers in low resource settings. This has ranged from running live online classes to small groups of doctors in Somaliland, at that time at very low bandwidth. And very often what we found was that those doctors often had theoretical knowledge, but they didn't have the necessary supervision or case-based diagnostic support and how they were going to turn the theory into practice. So for the last few years, I think that's been really the focus, is how to make online learning so that the knowledge and the theory can actually be turned into practice. I've also developed training content for the online training of family medicine doctors in the West Bank. And this has been blended learning, mixing content with live classes and face-to-face delivery, all of things which, as Catherine said, we're getting very used to now in these last few months. There are many challenges in delivering online content successfully. These can range from poor internet connection to lack of appropriate materials that match the local setting. MOOCs, or massive open online courses, really came to the fore in 2012. And they were snapped up very readily, but a lot of people would start the courses and then not really engage with them. And it was found that when you're trying to target specific audiences, you have to be very targeted in your content and tailor make it to them for them to maintain interest. So we realized that you really have to bespoke create content, really, for it to be for people to engage with it. Maybe the internet is unstable, maybe there's no time or support, and continuing education is sometimes quite a new concept in many low resource settings. But this is changing. We all know that healthcare workers now often carry smartphones. They're increasingly using these for looking for information professionally and for sharing resources. So this all opens up opportunities for delivering messages that can be more easily accessed, that they can actually then incorporate into their daily practice. So just next slide, please, Hannah. Thank you. So just a bit about Interburns. So Interburns was set up in 2006, and it's been working doggedly, I would say, with burn professionals around the world, and really, truly globally. So Asia, Africa, and the Middle East, and very much building a network of burn professionals around the world who can together tackle this forgotten global health problem. And Interburns has developed an integrated approach, which I'll talk about in a second, and has really developed and delivers tailor-made training programs to improve the quality of burn care in low resource settings. As you can see, 95% of burn injuries occur in low-income countries, and 70% of the affected are children. If you want to go on now, please. Next slide. Thank you. So our mission is to ensure that all burn patients have access to good care despite limited resources. Burns are a very hard sell in terms of talking about them, because it's not really the burn injury very often that does the harm, Some burns can be very simple, but they turn into serious injuries that have massive complications and can cause death. And it's that individuality of what we call the patient journey that means that burns there's not a simple fix. And it's also, whereas we have made great strides in high-income countries in dealing with reducing burns and dealing with burns, obviously the challenges are different in many different low-resource settings where this problem of burn injury is so acute. So Interburns has worked very hard to build a global network and to develop an integrated approach. And we call this developed from the ground up, in the way that the training is not adapted from materials that we've used here, but it's newly created with and by those who work in burn care around the world. And our main aim with Interburns is to co-develop programs and train trainers and then hand them over to national authorities or societies to run on their own. And they're very often delivered in the local language as part of regular national training programs. Next slide, please. Next slide, please. So as I said before, 95% of burn injuries occur in lower income countries, but most research is carried out or has been carried out in high income countries. And a lot of the changes that high income countries have managed to introduce are expensive technological improvements, which staff in low income settings obviously don't have. But the thing about burns is that very positive outcomes can be achieved from fairly simple improvements. For instance, more time with a physiotherapist can reduce the incidence of contractures and disability. Better nutrition, earlier surgery, all of these things can have a dramatic impact on the outcome of burn patients. So next slide, please. So this is just a bit about the burn patient journey, just to show you the complexity from the initial injury. And each burn injury has got a very unique, it's got its own journey, which will very much determine the outcome and whether the individual is able to return to a full and active life. So having developed this burn patient journey, Interburns has tried to develop training programs and tools which will support healthcare workers and national authorities in improving their burn systems from primary prevention to the most advanced healthcare setting. Next slide, please. As Catherine was talking about, we've done a lot in primary prevention recently in Ethiopia, Nepal, and the West Bank. And actually successfully in Nepal, our 3 project regions have shown no burns at all in the last 6 months. So we've shown that really we can dramatically reduce burn incidence. We've also developed basic burn care training for primary healthcare workers working in rural health posts. And this is really first aid and prevention. Surprisingly, healthcare workers have never really received specific training in burn care. So this is the first time they've often heard about many of these commonly held, commonly known ways to treat burns, such as running it under cool water. So basic burn care is handed over for training locally, and right down to essential burn care and advanced burn care in nursing and surgery. If you see in the center of this slide, standards in burn care, Interburns has also developed operational standards for burn units. So that's to help them see exactly what they should be aiming for. And linked to that, we've developed a very I'd say complex, but it's not really complex when you use it, a tool to support change, to support quality improvement. And I'll come on to that a bit in the end. So Interburns programs target key stages in this journey. And this comprehensive portfolio, next slide, please. This comprehensive portfolio of training programs has been delivered and handed over and rolled out in pilot programs in several project countries. And they're very hands-on and very face-to-face. Next slide, please. Yes. Yes, this one. The challenge is how to translate these very face-to-face hands-on courses into the online environment so that many more people can access them. And the first time that we did this was with the Essential Burn Care course. And in fact, the way I became involved with Interburns was through a research project with the Centre for Global Burn Injury Policy Research at Swansea University, where I was looking into how some of these materials could be put in the online environment. Because what we want to do is we want to broaden access to this knowledge to improve working practice. So the first way that we did this, next slide, please. So we ran a survey of participants of Essential Burn Care. You can see on the right-hand side that burn healthcare professionals come from a wide range of professional backgrounds. And the majority that were doing the Essential Burn Care course were nurses. And this is because Essential Burn Care course is aimed at intermediate burn units. And we found through this survey that in many cases, healthcare workers have leaped over computers and were much more using their mobile phones for accessing knowledge, as well as obviously for social media. But the fact that they were searching for information using their mobile phones was very interesting to us. And we realized that any content would have to be created so that it was mobile friendly, a mobile first approach, so that they could easily access it. Next slide, please. So these are some of the common problems we found with online courses. As I mentioned earlier with MOOCs, so content is often not relevant or targeted, and it's often created in high income settings and adapted, which really, you have to be terribly, it has to be localized as much as you can, and not targeted at the mass market. So you really have to understand your audience and understand what their needs are and how they're going to access this in order for them to engage with the online content. Very often the language is overly complicated and off-putting. We know that healthcare workers worldwide, and particularly in these low resource settings, and particularly working with burn patients, are extremely tired and overworked. And they have found work, they sometimes get quite little support. So content there has to be a real need to access this content. And once they've accessed it, it has to be very directly talking to what their needs are in very clear language. And we also looked at the method of delivery, as I spoke about just now, trying to deliver this so you could access it on a tablet or a mobile phone. Next slide, please. So these were some of the things that we kept in mind when we were developing the Essential Burn Care course. So keep the text simple, cut it down, which really helps to distill what you're trying to say. We color-coded everything, so there was green, which would indicate knowledge, and red was something that they could put into action. Very clear objectives and closely aligned activities. We created presentations which were short, and they could download them on PDF. So that if internet was unstable or electricity was unstable, they'd at least be able to download the PDF and look at it. We mixed up content with exercises, questions, and case studies. We included videos, and we were always stressing how to apply it in the setting, with giving very local and regional examples. And we also found that quizzes were very much enjoyed, and also a great vehicle for learning. Healthcare workers were engaging with this and talking amongst themselves as to why something was wrong or right. Next slide, please. So this is an example of what the Essential Burn Care course looks like. You can see on the left, there's that green banner for knowledge. And we just kept the language as simple as possible with photographs and quizzes at the end of each section. And then at the bottom right-hand side, you'll see there's the knowledge and then the action box. So we had that at the end of each section. So it very much mirrors the Essential Burn Care Manual, but it meant that all the way through, their participants are being encouraged to think about what they can do in their setting and how they can take this knowledge and actually push it into practice. Next slide, please. And this is another aspect. See, on the left-hand side, you have a red banner, which means for action. And we're always, if you see the bottom right picture, we're always including pictures of objects that they can find in their environment, really. So this is on how to make splints out of plastic piping, which is very readily available. So this is what I mean by being built from the ground up. There's all sorts of ways to create these splints in the environment where the healthcare workers who we're targeting are living. And we're often putting videos onto the course as well. Next slide, please. So we did quite a lot of research into online platforms because it's not obvious. There are several platforms out there. Many of them are either very expensive because they're focusing at the mass market, they're focusing at universities where they can cost thousands of pounds a year for a subscription, which often smaller charities don't have access to that kind of funding. And having done a lot of research, I've actually found a very, very good platform called Braincert, which is extreme. It's one of the cheapest, but it's actually very user-friendly, and it was very easy to set this up. So we could easily set it up and configure it, and it has a learning management system. So and it collects all the background data. You can upload all sorts of different kinds of content. There's a live classroom, and it's affordable for a small charity. You can see in the bottom left here the spike during early stages of COVID, as people were looking for online content, really from around the world. So those countries listed is just a small example of countries where people were looking for content and finding the Essential Burn Care course, which we were really pleased to see. Next slide, please. So this is just an example of the dashboard, which just shows you how it's very user-friendly and easy to set up, and it's also very good for if you have funders you have to report to. You can easily download reports, which is very useful. I just want to talk a bit now about a few of the other projects we're working on at the moment. Next slide, please. So this is, I just want to spend a few moments talking about the standards and the delivery assessment tool, or DAT. I spoke earlier about the operational standards for burn care, which Interburns has developed to help burn units around the world in low resource settings see the achievable human and physical resources of where they should be aiming for. And in linking with that, we've developed the delivery assessment tool, which is to be used by burn teams as part of focus group discussion. And it takes maybe 3 hours, so a morning or an afternoon, to run through a series of, to talk in your focus group, but we guide that discussion. And it helps burn teams self-assess their burn unit. So the delivery assessment tool has until now only been used within Interburns projects. So we have a wider comprehensive project in Ethiopia or Nepal or Bangladesh or India. We will very often go and help that burn unit run a focus group and run the delivery assessment tool and score their burn unit, and we'll give them a lot of support in doing that. But we can't do that. We can't be everywhere. So we want to make this much more widely available so that burn units really around the world can self-assess their burn unit based on these internationally accepted operational standards. And in order to do that, we are in the process of creating an app. If you can go on to the next slide, please. So this is the paper-based delivery assessment tool. And the idea is that the burn unit meets for, as I said, a morning, and a facilitator will take them through a guided focus group discussion where they'll talk about 10 service areas and subsections within those areas. And they will, as a group, arrive at an understanding of where they think they are, whether they do, for instance, carry out prevention programs, or whether they're not involved in prevention, or whether they have access to a physiotherapist, and so it covers nutrition and surgery, so all aspects of the burn service. So they will run through the guided focus group discussion, and this was all paper-based originally. So next slide, please. But what we're working on at the moment is turning this into an app, so that burn units around the world and low resource settings can access this through a simple web-based app. Download, on the left, you'll see the guided questions and areas for discussion the focus group will talk about, and some examples of where the burn team agrees that their unit is. For instance, this one is on burn prevention programs, no activities, but steps are in place, right up to regular formal activities. So they would circle which one they think, and then they would be given a scorecard. And the idea is that when you carry this out every year, this could be the basis for quality improvement projects. So if you can just go on to the next slide, please. So this is the screenshot of the web-based app. As you see, it's very clear and simple to use. And they would talk about and select the ones they think are most suitable for their burn unit. And at the end of this, they're given a scorecard. That's an example of one just at the back there, where green means they're on track and they don't really need to do anything in that area. And red is a flag for priority, so they need to pay special attention to that area. And what the delivery assessment tool is, it shows them very clearly where the gaps are in their burn service and where they should prioritize attention. And as I said earlier, this is not, they're not necessarily areas where they're going to need a lot more funding or they need more technology or more equipment. It's very often process issues. For instance, we went to a hospital in Ethiopia and they ran the DAT. And we could see from the DAT that there wasn't much access to physiotherapy for burn patients. And so burn patients were leaving and they would very often develop contractures. And we showed this to the director of the hospital, looked at this and said, well, we have a physio in a different part of the hospital who can easily come to the burn unit for a morning a week. So that was a scheduling thing. But instantly that meant that the next time they did the DAT, the score would be improved. And so we're talking about quality improvement through achievable actions. And the DAT helps to break this down so that it's much easier to see where improvements can be made and how they can be made. On to the next slide, please. And this is another course that we're working on now, again with the centre at Swansea University. We had hoped to deliver face-to-face an implementation and improvement science course in Jordan in the summer, but obviously that was not allowed because of the travel restrictions. So we've adapted the content and we're building it to be an online course which will be open access. And again, this is it's a mix of text-based and image-based, and then we have interactive tasks. So for instance, this knowledge to action pipeline, users can click through it and build their pipeline. So we're making interactive content to support the text. If you go on to the next one, please. Next slide. And this is coming up to the final slide. So I just wanted to give you a few examples of where our partners, our project partners, have also been going online and using social media. We have been working a lot with in the occupied Palestinian territories in the West Bank and Gaza, and also Nepal and Ethiopia, doing prevention work. And there were a lot of things planned in January, February, which had to be dramatically changed. But there are teams there, our partners there have been really creative in how they're spreading burn prevention messages. So, for instance, on the left here, they worked with Bedouin communities who suffer very high burn injuries. And the children in the communities made these puppets, and they filmed the show and they put it on social media. And that's been shared so widely that it's just another way of delivering prevention messages. And BBC training has been carried out on Zoom recently in the West Bank. It's not ideal because we like the hands-on face-to-face training, and that won't stop, but at least it means that right now, when no one can travel and people are in lockdown, that they are being able to still learn. And also sharing prevention messages on radio, TV, and Facebook and popular social media sites where things get shared a lot. So this is just to give you an understanding of just the different ways that we've been tailoring our content and trying to give wider access to our target audience, really. So I think that's, I'm really happy to have any comments or questions about any of that. And also, if you've got any experiences yourself that you'd like to share, that would be great. Thank you.
Lucy, thank you very much. That was really, really fascinating. I've been scribbling away here.
Oh,
If people have questions, then there's two ways you can do that. You can either put it in the chat there, or in the specific ask a question box, which is at the bottom of the screen, if people want to put it in there. So I have actually got a few, but somebody has beaten me to it with one question I was going to ask, which was the technical bits of it, which lots of us are kind of a bit mystified by. So there's kind of the technical bit, and there is the kind of whole approach and ethos and pedagogy bit of it, I suppose. But I was interested that you were using an app, and the question is, who's supporting the development of the app? And that was my question as well, because we've recently been we have been developing a course for monitoring women in labour with our partners, and that was a co-produced content with them, and it was going to be put into a MOOC. But then we thought that it might actually be easier and more useful to turn it into an app. So, but something we had completely no idea about how to do. So have you got some advice about if people are looking at developing apps, how and who can help?
Yeah, I mean, I think apps are the way to go. And there are these web-based apps which are they kind of slightly sit in between computer and mobile phone. And I was actually put off a lot by developing an app because it was very expensive, and we thought it'd be very hard, hard to access because of that and hard to build. But I've actually, now that there are developers who are building these web-based apps, it's actually much cheaper. And it's, so I've just been lucky to find people to work with who are able to build them for not a great amount of money. So I think it's almost, it's that bit between the computer and the mobile phone app and their web-based app, so that actually it's hosted, but it's accessible through the phone, and it operates and looks like an app.
So have you got any advice on how one should start looking for the right people to help?
You'd probably send me an email.
You don't want to be out there in the public domain. Okay, so Lucy's happy to be contacted, everybody. And another technical question, which is just a one-word question, but oops, I'm dropping things here. The online platforms, that's another issue we've been thinking about, especially in terms of education. So the like platforms like Panopto, which quite a lot of the universities are using for teaching with students. But somebody in the chat has put Braincert, and I picked up on that. You'd found a platform that you were talking about using. It looked great, the examples that you showed.
It's really great. What's it called? It's a very weird name, and I think they really shouldn't call it that name, and I'm very happy to give them a big plug. But I did spend a lot of time, I mean, really months, because what I was looking for was a platform that had live classroom ability. Obviously, we need that so much now because we've got Zoom, but at the time I was looking for something we could have a live classroom where you could put up slides and you could have video and audio and text-based chat, because low resource settings, sometimes you need to just have text-based chat. So I was looking for the ability of live classroom and an LMS to host PDFs, PPTs, all sorts of different kinds of content. And what I found was that in developing these educational platforms, very often they'd gone down one route or the other. So I found Braincert, which is brain and then CERT, Braincert, and it's about $1,000 a year for a subscription, and it's very configurable. So you don't get any support in terms of setting it up, but it's very user friendly. And even I, who I'm not techie, I'm quite techie now, but I fairly quickly found my way around it, and I found it to be very good indeed. And I think it's very good because we had that problem of looking at Canvas and Blackboard, and a lot of these different ones were really £8,000 or £10,000 before you'd even, just to get an annual subscription. And for small charities, that's not possible. And we've used the platform for live classes and, as I said, online content all over the world in low resource settings. So there's not a bandwidth problem, which very often there is with these platforms. Yeah. And if there is a problem, then you can turn off the video or turn off the audio. But again, I'm very happy to share any details of that if anybody wants to get in touch.
Well, that's really helpful if you've done the exploring the alternatives, because that's probably the steps that we're at.
I'm kind of tearing my hair out, but the Braincert came along to save me, and it's worked very well indeed. And it's now carrying the program that I showed you, the Implementation Improvement Science course. That's also going to go on that same platform now. So it's you can just load up as many courses as you want, and you can create groups, and you can look at you can manage your users and manage how they're using it and set up quizzes. It's just very, very good. So they should give me a commission, I think.
Somebody has asked, which countries have you used it in successfully?
We've used it in Ethiopia, Nepal. I mean, if I think about the people who are looking at the Essential Burn Care course, they're literally worldwide. So Iraq, Syria, Burundi. I've used it for online sessions in the West Bank and Gaza. So places where you might normally think there would be bandwidth problems. We had some problems in Malawi. And I think that is because of mobile phone connectivity. Data costs are very expensive in Malawi. So it was sometimes quite expensive for them to use their data, but I think Malawi is known as being one of the most expensive countries for data. So that was a data cost issue, really. But I haven't, and they have different data centers all over the world. So it's, I really haven't found any problem with it.
Okay, that's good to know. Moving on to a question that's specifically about burns, Mohammed is asking, are there any new techniques for skin graft in low resource settings?
Yeah, Mohammed, I don't know where you're asking that question from, but I'm not a clinician. And I think I would advise, I'm not sure if you're a surgeon or what level of burn unit you're working in, but I would advise you to look at the Interburns website, and we have several videos on there. And we also have the Essential Burn Care Manual, and send us a contact through the website, and I can put you in touch with somebody who will be able to answer that. But I don't know if you're a surgeon, or you sound like you're a surgeon.
Maybe Mohammed, if you could put that in the chat box, come back to us. I'm not clinical, sorry. What's your background, so we might be able to help answer that question more specifically. While Mohammed's doing that, oh, there we are. He's a GP practicing surgery.
Okay, where do we know?
Where are you? Somalia. So I would guess, Mohammed, you are, as a GP, you are dealing with absolutely everything. So you're a person of great skills across the board. So you're talking about a frontline healthcare worker.
We do run an advanced burn care course in surgery, but there's currently we don't have resources online for that. That's generally delivered internationally, face to face. But again, if you want to send me a question through the Interburns website about that, then I can channel it in the right way.
Well, Mohammed, it sounds like you might be able to start co-producing the advanced burn care course online. It might be very helpful in developing that and moving it online. So get in at the beginning there, Mohammed, and get in touch with Lucy. So, if I move on, there's another question. I noticed that's from Bryony, and I noticed you before, Bryony, that you are working in Kurdistan in northern Iraq, and you said that you were supporting, or there was a big issue with young women who in increasing numbers are self-immolating. I noticed that Bryony put that in the chat before, but the question is, have you been able to get messages across in Iraq through the medium of TV and radio?
We haven't been doing work specifically in Iraq. We have had people from Iraq looking at the Essential Burn Care course, but we don't have a burn prevention program in Iraq. The burn prevention programs we've had have been in Ethiopia, Nepal, the West Bank and Gaza. And while we would dearly love to do work in Iraq and roll out those burn prevention programs, it's all very dependent on funding. So we need partners and we need funding. Because we can't really go anywhere without local partners. So we're very, very keen to do work there, but we haven't yet.
So Bryony, it may be that you might be a partner on the ground in Iraq for Interburns. So again, get in touch with Lucy through the Interburns website. But want to pick up.
There's the funding issue. Don't forget the funding issue. We need partners and funding. We can't do it without funding. So, but we're very happy to jointly look for funding. That's not a problem.
Well, we always come back to that, Lucy.
I know.
But I just wondered, is that an issue that you've picked up through the courses? Is kind of self-injury and self-harm resulting in burns?
Yes, in fact, Interburns did a lot of work in the early days with Bangladesh and the Acid Survivors Foundation, and that was very much to do with that was domestic violence, really. But there was a lot of burn injury from that.
Okay, it's scary, isn't it? I'm just looking at the questions here about. If you needed any support from a developer in the partner countries to make the content work within their data bandwidth issues, when you're talking about co-producing the content, I suppose this is co-producing how it might work in different settings.
We haven't needed. We've needed. Yeah, I've worked with content developers in partner countries, but not specifically to do with bandwidth issues. But yes, I work very regularly with. I try and find developers to work with me. We have a wonderful translator in Gaza, and if I can find content makers in countries where we're working or not working, then that's always fantastic. That's one of the great things about online connection, is that I work with people who are all over the place, and try and find people who are all over the place.
So it sounds like a fascinating job. I wanted to ask you, and this is a challenge that many of us face. You mentioned in the beginning that when there was kind of an explosion of free online learning and the MOOCs came out, that lots of people would get interested, but then drop out and not engage. So, and you've talked a bit about methods that you've used to keep people engaged. How do you find healthcare workers to come to you in the first place? You know, how do people find out about your courses, and how? Because I'm thinking that Burns is not. It's not. Trying to put this in a way. I'm not going to use the word sexy, but it's not the most attractive topic. And if you've got frontline healthcare workers who are really tired, this probably isn't top of their own learning needs that they've identified. How do you get people to actually realise that this is a significant issue for them, and that they need to know more about it?
It's really hard. Burns is really hard from lots of, I mean, you know, when I talk about the patient journey to begin with, that's one of the most difficult things to get across to people, because it isn't just one thing that you have to do. It is this integrated approach. I think burn healthcare professionals tend to find us because they are working in burns, and it's so burn patients are very often in hospital for a long time, and it's a very, very difficult area to work in. So a lot of people try and get out of working in burns because it is exhausting, and you're with patients for a long, long time, and they haven't really had any training, so they're left a bit at sea. But the ones who stay are really dedicated, and they want to know more. So in a way, this is how Interburns has built up this fantastic network of plastic surgeons in Ghana, nurses in, you know, just a fabulous network of burn people who choose to work in burns almost because it's challenging and it's difficult. And either Interburns has a program there. So in the past, national authorities have contacted Tom and said, for instance, in Afghanistan, we need a burn care strategy, come and assess our burn services. And then, so that's a very personal connection. But that, it's like a snowball, the Interburns network, is it just grows. And those people who are working in burns in those countries get to hear about it. And then they either get onto a basic burn care course or essential burn care course. But this is why it's great to put the EBC online so that other people can access information. I mean, just like Mohammed just now, he's got a specific question he needs an answer to. And this is why we need to put more information out there so that people can find it, because it is very difficult to get information that is practical and relevant. But no, there's a lot. We always find there's a lot more that we could do, but we're tiny, you know, in a way. In terms, you know, we've had a big impact, but we're tiny in terms of number of staff. And while we'd love to work in more countries, it is just dependent on this great, big funding word. So they find us, or we have good local partners who work with the local hospitals, and when we've run courses in those countries, we've grown the network further.
You do sound like you kind of attract champions who are passionate and take it forward in their own settings. I know at our conference last year, we had one of your champions, and she had actually become a nurse because someone in her family, I think it was a niece. So when she was a young woman, her niece fell into a fire and was quite severely burned, and she saw what her niece went through, and that inspired her to become a nurse in the first place, and then to specialise in burns care. So I would imagine there are people who, for personal reasons, either through their professional life or their family life, become champions, and then that's the ones that you're working with, aren't you, to spread the word. And market what you're trying to.
Yes, I think it's very often a personal connection, because why would anybody know about it unless they'd had a direct experience of it? It's not one of those things exactly that we read about ever. It's not very much in the press or the media, and so you need people who have direct experience of it to then bang the drum and advocate really for it.
Absolutely. We've got another technical question here, which is, and I'm not surprised that we're all asking technical questions, because it's the stage that we're at. We're desperately trying to sort this out. So the question is, are you only using Braincert at the moment? Do you need another app for your self-assessment tool? And are there any other apps or web platforms that you find support your work?
We're using Braincert for the online courses, and the app is not on Braincert. It's hosted on a different. It's hosted differently from the platform.
One that we need to contact you personally if you want to know. Are you happy for people to find you?
Sorry?
Are you happy for people to contact you through Interburns personally to ask any further questions?
Fine. I mean, I'm not a developer. I'm not a techie person. I just work with clever techie people. I find clever techie people.
Well, that's exactly, sometimes if we go straight to the clever techie people, then we don't understand what they're talking about.
And they're often very expensive, and you can often spend a lot of money, which no one has. So this development of this app is very exciting for me, and it's very new for me. So it's the first time, because I knew we had to create an app a couple of years ago, but it was always, people were saying 15, 20,000, and yet there is a way to do it without creating a full-blown app. But now I'm causing all sorts of issues for myself.
We've got a few minutes left. It's a question that Bryony, because we were talking about Bryony's got a partnership in Kurdistan in northern Iraq. So she's asked, what kind of local partners are you looking for?
Generally, Interburns has this integrated approach. So we want to work in places where we can not just go in and come out. So not just deliver a training course and then leave. We almost want to have a long-term partnership with the system. So it could be an NGO, but the NGO needs to also work closely with the Ministry of Health, because this is something, burns is something which will only really change if I think the Ministry of Health is encouraging it. But no, so it could be an NGO, and it could be with the ministry. I think it's just a partner who is able to work within the health system, within the hospitals, and be listened to, and to enable to create that change. So it's a kind of almost a longer term process at all levels. That is the way that burn care will change: the prevention, the basic, the intermediate, and the advanced.
Great. Well, I'm going to ask one more question, and then if you want to just kind of words you want to say at the end, Lucy, to wind up. Well, it's another kind of it's not sort of technical question, but it's when you're doing these courses, say for instance the Essential Burns course online, how much time commitment is there for a moderator or a tutor while you're delivering the course? Because that's often the limiting factor for us, is the amount of time commitment you have to put in to deliver the course.
Yeah, I don't put in any time commitment because we don't deliver live sessions. So for the Essential Burn Care course, the whole thing is online, and I'm not, when people can sign up when they want, where they want, and do the course. So there aren't any live classes. I could easily on this platform put in some live classes. So have an hour on a Sunday evening, for instance, every other week or once a month, where students can log in and you can talk about things. But we don't do that with Essential Burn Care for the very reason there are very few of us, and we're all we all have all sorts of stuff going on, and we can't commit to that. I have done that for the program in Somaliland, which was purely based around live classes. So I think that's really up to what kind of input you want to have with your students. I mean, it isn't onerous. If you're saying it's an hour on a Sunday, and you have a rotation of people who are willing to host that hour. And the way we did it with Somaliland was medical students would bring cases that they'd seen in the hospitals, and they would present the case. And then there would be some discussion around diagnosis. And so it was an hour, which was very interactive and very, very useful for them, because what they didn't have was the diagnostic skills. So I think if it's focused and actually the case is being brought to you, and it was very fascinating, it's not a huge amount of work for you. But we don't do that with essential burn care, just because there aren't enough of us, really.
Yeah. It is a balance, isn't it? Because we know that, I mean, the evidence is that the more interactive a course is, if there's more live content and the more students feel that there's somebody there listening and there's somebody with expertise, they're more likely to engage and they're more likely to complete.
Exactly. So I think we're doing this implementation improvement science course, which has a very practical element to it. And the idea is to interleave that with live classes. So we've built interactive content and videos and activities, and we hope to put in, say, over a 4-month course, 2 or 3 sessions where we come together and discuss it. But that's really up to how many people are involved and how much time you want to commit to it.
Well, thank you. I think we're kind of coming to the end of the session, and I hope we've managed to answer. I've been trying to keep an eye on questions coming there, and I hope I've managed to ask all the questions. Did we do all right, Hannah, there? Did we get missed to get them all in?
Catherine, you've done a wonderful job of asking questions. And Lucy, you've done a fantastic presentation. Thank you so much. I'd also like to thank everybody for their questions today. It's been really enjoyable for me, especially as I'm really interested in Interburns' work. So thank you, everybody, for a great session. But before we say goodbye, I am going to share my screen one last time, which has just got a little thank you from us. And I just wanted to ask you to, your feedback is really invaluable for us, to help us improve what we do and make sure that our events are relevant. So if you could just take a little look in the chat box to see a link to our feedback survey, the tiny, both in English and in Welsh. So I just wanted to invite you to contribute a little bit more. And thank you once again for joining us today. And in particular, thank you, Lucy. And thank you, Interburns, and thank you, Catherine.
Thank you, everybody.
Thank you very much indeed.
Okay. Goodbye, everybody.
Bye. Bye.
On time too. Cheers.
Bye.